Hi.
Nice to meet you.
Nice to
What was your name again?
Courtney.
Courtney. Nice to see you. I like your scrubs.
Thanks.
I
I
need
want to be a PA.
Okay, good. I want you to be one. I want you to be one. So I'm gonna wash my hands, and on general inspection, I would just look to see if she was in any obvious distress, any even diaphoresis, if she was splinting or posturing, protecting the knee in any way. I'm gonna ask you to uncross your legs here, and I'm gonna note the alignment and symmetry of the knee itself. I'm going to ask you, would you mind, in looking at the tone of your thighs, could you tighten up your thigh by pressing your leg against the table? Tighten that thigh up and look at the symmetry and tone of the quadriceps. Relax. I'm going to note the suprapatellar pouch and see if it has, if it's well defined, or if it's hollow in extension, or if it's puffy with fluid. I'm going to note any edema or any obvious ecchymosis in the area, any obvious deformity, of course, and look for any effusion that might be present. I'm going to note the muscles for any obvious atrophy, particularly noting the vastus medialis, comparing them bilaterally, the quadriceps muscles. I'm also going to notice, we're going to also check two other things, and I'm going to ask you to flip yourself right around here and just hang your legs off the table. And we're going to go ahead and I'm going to ask you to straighten and bend your knees for me, and I would stand right in front, and we're going to look at those, and go ahead back down. I'm going to watch your kneecaps, and we're going to go ahead and come on back up, and we're going to see that the kneecaps track properly, all the way down and up again, and note the tracking, and noting any abnormalities. And then could you come off the table for a minute? And I'm going to ask you just to stand nice and tall, and I'm going to look for any genu valgum, any genu varus, or rocker bottom, which would be more hyperextension. And go ahead and hop up on it. And swing your legs right around here. Alrighty. And we're going to go forward here, and I'm going to push around. And the affected knee is the left knee here in this case, so go ahead and push around a little bit. And you let me know if you have any tenderness at all. First area that I'm going to check is your suprapatellar pouch, which is right up in this area right here. And I would press on that area, watching the patient, seeing if it's any tenderness or if I appreciate any fluid in that area. I'm going to check the quadriceps tendon, and that would be above the kneecap going superior into the quad, looking for any tenderness. The patellar tendon, which is down below, connecting the patella all the way down to the tibial tubercle, and note any tenderness. I'm also going to check your medial and lateral joint lines, and I'm going to ask you to bend your knee here for a second, okay? Because it's easier for me to get to your joint line. I just sort of put my thumbs right in here on either side of your patellar ligament, and that is the indentation of the anterior joint line. And then I'm going to go kind of work my way through the joint line laterally between the proximal tibia and the distal femur, and work my way through there, looking for any point tenderness, and the same on the medial side, looking for any point tenderness. And then I'm also going to palpate we'll go ahead and straighten you out there. I'm going to also push on the lateral or fibular collateral ligament, and I find the head of the fibula here, and I head northward, and I push on that collateral ligament, noting, tell me if it's any soreness. And then the medial collateral ligament, which is on the medial side, you can see this one over here on the medial side, and I usually start low on the medial collateral ligament, and I head northward over the joint line and up onto the distal medial femur. Okay, so for this side of the room, it's here all the way up onto the femur, noticing any point tenderness, okay? And then the popliteal fossa for a Baker cyst, just palpating in the back to see if I can just palpate a Baker cyst right in the center there, a little cyst, and you don't have one of those. And then I'm going to ask you to do some range of motion, okay? So let me do this. Would you mind sliding your legs off the table? And I would just like to see active range. Could you straighten your legs all the way out for me? And I want to make sure that actively she straightens to 0. Now you can flip back around again. Okay. The other thing I want to do is just passively see if it goes to 0. And we don't quite go to 0 on that one. And now I'm going to ask you to bring your heel and slide your heel all the way up so that your heel comes as close to your hamstring as you can, and the other knee too. And let's see that if they match. You can see that there's a little bit of loss of flexion with that. And then I'm going to also push on your legs. There's a couple of different ways to do this. I can ask, probably the simplest way is you flip back around here, and I'm going to get myself in a comfortable position. I'm going to ask you to straighten your leg and push against me. Best to check strength in the unaffected side first. So your affected was your left. And we're going to ask you to straighten your leg out as hard as you can against me. And I'm just going to let her isometrically push. And then I'm going to do the same thing with flexion. Bring your heel under the table. Good. And then we're going to do the same on this side. Go ahead and push and pull your heel toward the table, checking both flexion and extension, muscle strength, and you are on 5 out of 5 on both of those. And then we're going to go ahead and do some special tests, okay? So I'm going to ask you to swing your legs around again. The first test is a test for milking effusion, and for a minor effusion. And all we're going to do is, we know that the fluid kind of gets caught up throughout the joint capsule, inside the joint capsule, and it will even pool up here above the patella. So we're going to kind of milk that fluid down, and then we're going to press on one side, press on the other, and you do have a tiny fluid that I can see pop through here. It waves through, and it waves through, and it waves through. Can you see that? Right there. That is a minor effusion. So you do have a minor baby effusion here, okay? For a major effusion, which you do not have, but if there was one, we can simply, again, kind of go ahead and push the fluid down a little and press the patella downward, let it go, and it floats up to the surface. As we press it downward, we can see fluid bleb out on either side, and as we let go of it, it rises and floats up to the surface. That's for more of a major effusion. It's called a ballottable patella, and we're ballotting it down. I'm going to also check your ligaments now. We're going to check the valgus and varus, and I'd like you to lie back on your back and get nice and comfy. And since we want to know what normal is on this, I'm going to start with your good side, okay? We're going to go ahead and just relax your leg. And when we grab a hold of them, the first reaction is that they tighten up. So we try to just want them to get just a little bit of relax. Sometimes if they're tightening their quad, I'll just move it a little, bend them a little, and try to get them to relax and feel comfortable with you doing this test. We're then going to press, we're going to stabilize with my left hand here on the lateral side, and I'm going to use my right hand to try to open up that medial collateral ligament, okay? So just relax, and we're just going to open it. And, you've got a nice tight ligament here. We can see it move a little bit in full extension, but boy, I feel a nice end feel. Then we're going to go into a little bit of flexion, 20 degrees of flexion, and we're going to do the same. We're going to open that up, and we see that opens a little bit more, because the capsule is being taken away now, and it's mostly the medial collateral ligament doing its job, okay? Since I'm over on this unaffected side, it's a nice quick way to see the other side, the lateral collateral ligament, and I might just slide between you here and just relax. And now I'm going to do the lateral collateral, pushing in full extension, bend her to 20 degrees or so, and do the same. And now that I've seen what normal is, I'm going to go to abnormal, okay? Now in this one, we'll go ahead and, I'm going to stabilize right here, just kind of get her to relax a little bit, just a little bit of pressure in full extension. And again, I feel a nice end feel. We're going to bend to about 20 degrees. And again, it opens up a little more, but a nice end feel. And then switch around, do the lateral collateral, full extension. And I step in here a little bit, and it kind of helps me. And at about 20 degrees. There's a lot of different ways to do these. If you had difficulty maneuvering it and we were getting too much rotation, we can just slide the knee off a little bit and do our medial collateral. If you slid her over a little to the edge, we can do it this way too. This way, bend her, do it this way. There's a number of ways to do it. Okay, so that was our lateral and our medial collateral ligament. And now we want to do our anterior and our posterior cruciate ligaments. One test, the anterior draw test, this one, I'm going to ask you to just let your foot be right on the table. Some people will sit gently on your foot so it doesn't go anywhere. And then I just grab a hold of the tibia. I just picture that tibia being in there, and I put my thumbs right on the tibial plateau, and I'm just going to draw it toward me. It's the anterior draw test, okay? So my hands are doing this. Make sure the hamstrings are relaxed and looking for any looseness. Posterior draw is pushing this tibia distally from me, and I push downward and see if it sags back like this. Okay, and so we'll do that on the other side. Anterior and posterior draw test on this side. Again, relax the hamstrings. And I can see a little bit more movement on this side because I think we had an ACL reconstruction there. But I feel a nice firm end feel, so it's doing its job. Okay, posterior draw. Little tiny end, a little bit of movement, but good end feel. All right. Then the second test, and for the anterior draw, or for the anterior cruciate, excuse me, is the Lachman's. And this one takes away the cartilages can kind of hold on to that tibia and femur so that they don't displace. This one eliminates that factor, and we just bring her up into about 20 degrees. We unlock her knee, grab a hold, and all I think about here is grab a hold of the femur, grab a hold of the tibia, and stabilize the femur and draw the tibia forward. So my hands are doing this. Okay, you gotta get her to relax a little bit. And I don't feel any movement here. And I'm gonna slide, I need to slide around to this side. Do the same thing here. And you can see movement, but again, I feel a nice firm end feel. And this is very common with an anterior cruciate patient. Okay, so that's the Lachman, and it's a very appropriate test to do. Then we probably have some other tests for the kneecap in here. The McMurray click test is for cartilages. And what we're going to do, sorry. We're not going to grab her foot, because she's ticklish. We're going to put our hands on the joint line here, and we're going to flex and extend, while we put a little valgus and varus stress on, and a little bit of internal and external rotation on, and we're trying to recreate and make the cartilage flap over itself. This would be one you do on the affected side really only because you're looking for that click. Okay, so probably should have done it on this side, but this side for the McMurray click test. Okay, the Apley compression or Apley grind test. Can you flip over on your belly? Please? You wanna, the grind test is actually, if I'll do the same like I did on this one, the affected side, we push downward and we turn and almost grind that tibia into the femur, grinding the cartilage. A positive is pain. You can do the distraction test then also. And on this one, you'd kind of do the same thing, and they wouldn't have pain on this because we're moving it, but we're separating the bones now, and that would be no pain. So a positive Apley grind. Okay, it would be pain. Okay, flip back over. And then patellar apprehension. This is always a nice one when we're chatting about how PA school is. And we had a history of patellar subluxation in the past, and we're wondering if she has some apprehension. So how is your PA school doing?
It's just so great.
You
My
like
teachers are amazing.
Are you in your favorite unit right now?
Yeah.
Orthopedic? Good. And a positive apprehension would be she would have stopped in the middle of the conversation and grabbed my hand or said, stop, because I was pushing her kneecap out to the side, and I was, if she had a history of displacement, a subluxation or dislocation, and she has apprehension, she would have stopped me from doing that or said, don't push on my kneecap, it's going to go. So that's the apprehension test. It's pushing, not pushing downward, but just pushing laterally and watching for apprehension in the patient's face, kind of distract them a little while you're talking to them, and do the test. And that would be obviously a negative. We also need to do the patellar compression test. Patellar compression test is when we have patients with patellofemoral joint pain, or certainly your chondromalacia patients. And what we're going to do is we're going to put some downward pressure on the patella while the patella is in this relaxed, the thighs in this relaxed position. Press downward and then ask the patient to contract the thigh, contract the quads, and what that does essentially is scrapes the patellar facets and where the inflammation is right against the femur and femoral groove and creates pain. I know you have a positive compression test here, but we'll demonstrate one, okay? So just tighten up your thigh, and I start gently here, and she comes up, and a positive is ow, okay? So all I'm doing is adding more compression while she scrapes that patella up in its femoral groove, okay? I think we hit them all.
Palpate the patellar facet.
Thank you. Palpate the patellar facets. In the patient that had a positive patellar compression test, you better believe her patellar facets might be a little sore. So all we do is slide the patella over toward me, and I get underneath it and palpate the medial facet, and I'm asking, does that have any pain? Yeah. And then I push it laterally, and I get underneath, and I palpate the lateral facet. Any pain there? And your patients with patellofemoral joint pain will be tender on either one or both of those facets. Anything else? Thank you for being my patient.
Thanks.